Assalamu alaikum wa rahmatullah. My name is Aisha Dalha Zubairu from Dutse LGEA. Yes, of course, there is some program which called Jichima.
The Jichima is very important in the state while because you as a teacher or as a civil servant, if you register with Jichima,
for teachers in the state that I think that there is some packages that are doing by Jichima.
Where we have started, and this is where we are now.
Assalamu alaikum wa rahmatullah. My name is Aisha Dalha Zubairu from Dutse LGEA. Yes, of course, there is some program which called Jichima. Jichima is part of the program that assists and helps the teachers for their health welfares. Every teacher has a register with this Jichima, and he has direct access to go to the hospital and collect the medicine for his 4 children. If the teacher is male teacher, registered for his wife. Well, if the teacher is a female teacher, just like me, I registered it for my husband because my husband is not a civil servant.
My name is Abdulkadir Yunusa, State Chairman, Nigerian Union of Teachers. Yeah, when we say health, we mean the general view of the health facilities. Okay? What we mean here, it depends on the level of sickness that somebody, a teacher and his family may likely experience. There is a package whereby if you have a maternity wife, you can be able to take her to the hospital, very, very nearest facility where you register with, and you can access the facility there, and access the drugs, and even the CA there. So all the scheme has taken care of that. So any facility, any health issue with regard to a teacher in the state is being taken care of by that particular scheme.
My name is Dr. Loy Musa, the Jigawa State Commissioner for Education. We have been here since 2018, and we are connecting that with the ministry, making sure that all the issues concerned with the education policy development, policy implementation, at whatever level is being organized and then being executed here, working in conjunction with all the related agencies, including the headquarters of the ministry, SUBER, the State University Education Commission, Islamic Education Bureau, Science and Technical Education Board, Women Education, the State Library Board, Scholarship Board, Agency for Mass Education, and then the tertiary institute also in the state, are all working with the purview of the ministry to make sure that the sector is being propelled forward and a lot of things have been accomplished and achieved in the specific time we have for ourselves. Well, teachers in Jigawa State, first of all, enjoy free flow of promotions from one grade level to another, and the usual annual increment which comes handy between the months of January and June every year. This is the first no teacher in Jigawa State is left behind when his promotion is due. He gets his promotion because we are lucky to have a program which introduced in 2019 to 2000, when we make sure that all staff who have stagnated on the grade levels are being moved forward to the next grade level. We did that exercise, and since then, 2013 to date, all our promotions are coming in handy as and when due. Twice in a year, January and then March. Secondly, our teachers enjoy what is called Teachers Inducement Allowance, TIA. This TIA is 100% increase of the basic salary of every teacher. As far as you're a teacher and you go into a classroom to teach, then you have 100% increase on your salary of your basic salaries without additions, without allowances, without this and that. These are paid only once. So that's one thing they enjoy at the secondary school level. At the primary school, they enjoy some what they call TSS, and they're given about 25% increase of their salary.
Okay.
3, most of us, the teachers also receive training, what you call Colostar training. This Colostar training was introduced last year, and we try to do training for teachers within the locality where they work. They don't have to move to go to far away places to attend trainings in terms of either the basic knowledge of their areas of study, or general knowledge, or maybe in terms of administration. But they receive this training within the cluster. So what you call by cluster training, every local government, for instance, if a local government has 10 geopolitical wars, these 10 geopolitical are divided into 5. Okay. So we merge 2 wars into 1. And all the teachers within the primary and junior secondary school within that ward will go to one primary school, and therefore facilitators will be sent there to go and teach them, give them extra knowledge, extra lessons as far as their teaching methodology is concerned. This thing is being done twice in every term. As the time students resume, we do the training, and then when schools are closing, we also do the training. This has really helped in bringing up teachers up to date in terms of their knowledge about their area of study, and then it's the general knowledge about administration in schools and the management of education. Apart from this, also we don't bother our teachers with too much posting. Each and every person allowed within his locality to work to make sure that he manages the affairs of children from this locality as far as their education is concerned. These are some of the benefits which our teachers get in the process of doing our work. And their salaries always come in S1ND. They have never surpassed the 20% every month without receiving their salary. Leave grants, leave allowances are also being paid S1ND. And teachers are also given the opportunity to pursue further education. Anybody who has happened to get an admission somewhere and he wants to go to continuous education, either first degree or master's degree or even PhD, they are given that opportunity, especially after preparing the 3-year requirement for working before you get sponsorship to go for further studies. These are some of the many advantages that teachers get in terms of welfare packages.
Okay, I'm Dr. Noura Ibrahim Kazore, the Executive Secretary, Jigawa State Contributory Healthcare Management Agency. When you talk about welfare packages for teachers, it's all inclusive. It's a cross-cutting issues. Okay. We are part of Ministry of Health. Like JICHMA is concerned with strategic purchasing of healthcare services for residents of Jigawa State. So our scope and our limit is within the ambit of healthcare purchases alone. Other welfare packages we may not know, but as far as access to service is concerned, I think we're on top of that. We've enrolled all the teachers in the state, whether secondary school teachers, primary school teachers, or tertiary institution teachers, so that they can partake in the healthcare contributory management agency programs. That is, what we usually do is that we just collect a certain percentage, is even not even percentage, it's a fixed amount from respective teachers' salaries that can be used as premium for them to access these services.
Thank you very much. My name is Dr. Kabir Ibrahim Aliyu. I'm the Executive Secretary for Jigawa State Primary Healthcare Development Agency. On a general note, when you're talking about healthcare-related welfare packages, we're talking about services that can be provided in our own facilities for different categories of people that come to access care in our own facilities. At the primary health care level and in the Ministry of Health in entirety, we provide packages of care ranging from maternity care, that is services related to women when they come to deliver, antenatal services, delivery services, postnatal services, that is 6 weeks after delivery, the kind of service that women will require. We also are talking about issues related to children's health, providing immunization, deworming program, malaria interventions, nutrition, ensuring that every child grows to the maximum potential. We're also providing care for adolescents, young people who are into school, ensuring that they have good growth milestone, they have good comprehension when they go to school, ensuring that they are off drugs, ensuring they have good sexual development and things alike. We also have care for the elderly, people who are 60 years and above, who are in need of different kind of services, take care of their old age and all that. So all these packages of care are available for all citizens of Jigawa State and anybody who comes into Jigawa, including teachers. But talking about teachers, like we said, that you might have known, teachers are part of the formal sector that we are managing through an insurance program where they have some contribution at the end of the month, and this contribution are packaged to health facilities where it's translated to provision of services. In those formal sector arrangements where you must have had the detail, the person who contributes is eligible for care, likewise his spouse and 4 biological children. So teachers are part of this scheme. These are the packages that are available for them. what we call a lifetime life cycle approach from cradle to grave. Right from when the woman is pregnant until when the person is old. There are packages of care relevant for the age and the social and health needs of those individuals from beginning to the end, and that includes teachers in the package.
My name is Awal Jibril. I am the Secretary of Association of Primary School Health Teachers of Nigeria, Jigawa State, WIN, what is by short we call it option. So some welfare package for teachers in the state that I think that there is some packages that are doing by JICHIMA. It is not only the packaging that you are seeing that government is doing, but
Assalamu alaikum wa rahmatullah. My name is Jamil Sani from Dr. Muhammad Sunusi, Dutse LEA. The only one that I know is JICHIMA. The JICHIMA is very important in the state. While because you as a teacher or as a civil servant, if you register with JICHIMA, you can have more access to the healthcare person. For example, if you go to the hospital, you have at least, you will pay for medicine for 10% at least. If the medicine is 1,000, you can get, if you pay 100 naira, you can get the medicine.
My name is Muhammad Ayuba, Executive Chairman, State University Education Board, Jigawa. And available, all packages for teachers. So, teachers are just a civil servant. So in Jigawa State, all civil servants, they receive some welfare packages. Particularly in Jigawa State, our teachers, they have it in their own salary. I think about 5% of what they earn monthly. That's a provision for the welfare to take care of their health and their families. So apart from that one, I think the Jigawa State government has established a unit called JICHIMA. That one is responsible for managing the welfare of teachers, particularly in the health facilities, where all teachers and the other civil servants in Jigawa State were co-opted into the programs. So this JICHIMA, they send us an invitation that we should send them the list on all teachers at the basic levels. So basic level means the primary and the junior teachers. So you already send them the list and they are being enrolled into the system. And I believe some of these teachers are now enjoying such services. So actually, this is where we have started, and this is where we are now. Yes, actually they came to us, therefore we gave them the list. After that, we advised them to reach the teachers at their respective localities. So the JICHIMA took these pains, therefore they visited all these local government one by one. They have a direct contact with the teachers. They got all their information, their biodata and whatever, all that has been captured in their system. So this is what you already know about the way how they enroll these teachers within their schemes.
You see, before any formation of any policy, there has to be a ground administrative criteria and structures that are usually put in place so that it can be the easiest way for any teacher to access that facility. Okay. We have made a provided policy whereby we sit working with the Legislative Council under the head of the heading of His Excellency the Deputy Governor, where we come up with a certain criteria which has been mandated as a policy, whereby each and every teacher can be accessed, may be able to access that facility in the easiest way.
The policies on this is that one, sick leave is a matter of individual perspective. Okay. Anybody, especially the female teachers, or even the male teachers who happen to be sick, as far as that is written to the ministry will maintain it and make sure that at least he's given all the services support he requires to get health. Okay. Either take him to hospital, subsidizing his expenses for the hospital bills, and probably even trying to take him to where we feel he can get better medical care. Okay. And especially for the fact that they said they have this issue of health insurance, something which teachers or all staff normally contribute some amount. Okay. And because of that, some of our hospitals give teachers or workers free medical attention after making that contribution. So once you have contributed, you'll be given one green card, and any hospital you go, every person is entitled to at least himself, a wife, and 2 children. So once you have a wife and 2 children, then you're okay because you only need card. Anyone among this category is sick, you take him to the hospital and he's treated free. Okay. Not only civil servants, all civil servants, including teachers.
Okay.
They enjoy that from the State Primary Health Care Development Agency in conjunction with an agency also from the headquarters, Abuja. I cannot recall the program, but that's how it is. You will be given opportunity for yourself, for one wife, and for two children. So once you have this, you go and you get free medical service. Only thing you do is you pay your contribution of, I think about either 500 or 1,500 naira in a month.
Okay.
And that money is being used to manage their health, including those of the children. So that's it. And then again, in the ministry, like for instance, our female teachers, if they have anything that has to do with maternity leave, when they write, they're given that opportunity because you don't really expect productive job from the woman who is in that condition.
Yes.
So the best thing is give her the opportunity to go back home, let her get her delivery successfully, let her win her child at least to a certain number of months before she will come back to school to continue the work. Okay. So these are issues that are there on the ground. There are, yes, policies written, but we don't even have to refer back to the fact that they are written, but we just have to do the right thing at the right place at the right moment.
As I said, it's automatic. The law provides that once you are a resident of Jigawa State, most particular, maybe you are a teacher, as a public servant, by law, you have to be in the program. It's not by choice. It's a mandatory program. Just as enshrined in the National Health Insurance Law now that has been passed recently. Health insurance is no longer optional. It's mandatory. Everybody has to partake. So by that, automatically now the onus is on us to make sure that these teachers access healthcare services as at when due. Not only healthcare service, quality healthcare services. That is the emphasis.
Well, yeah, there are policies at different levels. At the federal level, the Basic Healthcare Provision Fund has put up a scheme that's looking at the vulnerable population, which might include teachers, both informal and informal sector. They may benefit from such kind of schemes. So there are policies that guide who actually comes in to benefit those kind of services. Likewise, in the state, we have the like I said, the school health policy that is providing a comprehensive package for teachers and students in the education sector to see what kind of services are available for them and what are the requirements for them to access this service. So the guidelines that are enshrined in that policy that are providing direction to how this kind of service can be provided. Likewise, if you go to JICHMA, they will tell you about the formal sector setting where they have their own guideline and law that's guiding the provision of this kind of services. So we say, yes, there are policies on ground that are addressing the health workforce, including teachers in particular.
So there is policy, but the policy is that there are some forms that will be given to the teachers to fill it. When we fill it, they are going to take it to the JICHMA office and enroll the teacher in that JICHMA initiation.
The pre-MNCH program the Ministry of Health provides is a package of intervention where certain amount of money to the tune of 75 million naira on monthly basis is provided for care of what we call pre-maternal and neonatal and child health services. So for people who are not part and parcel of the formal sector and they are not benefiting from the equity program by the Basic Healthcare Provision Fund, that's yet another scheme that is going to provide care for people irrespective of who you are, including teachers. So under that system, the free MNCH will provide care for pregnant women while they're pregnant at the time of delivery. 6 weeks after delivery, the care will cover that kind of setting, including surgeries, including blood transfusion to some extent and all that. There are also packages within that same scheme where children can be provided with care from 0 age up to the age of 5 years. In addition to that, we also have provided within that pre-MNCH packaging care for boarding schools. When children from boarding institutions come to health facilities, they fall into that kind of scheme where they can provide it with care within the pre-MNCH packaging. So when you are extending those kind of care to children in their schools, sometimes extend to the teachers who come along with them and so on. So we say, yes, there are other programs like the pre-MNCH that's providing care to teachers as well as students within the education sector.
As I rightly said initially, when we first started, this is all encompassing program. Because of transparency and accountability, we ensure that the civil society organizations are involved in this program, the community-based organizations are involved, faith-based organizations are involved traditional rulers are involved. Everybody is involved. So everybody has the right to walk into any health facility and inquire about their modus operandi, what is happening. Are my people getting access? They have the right. It's enshrined within the law. So that it's not only JICHMA, the purchasing agency, that will do the monitoring and supervision. Other people also are involved as part of stakeholders to ensure that quality of service is the key thing, is what is accessed by these teachers.
If it is in the part of teachers, we have what we call the ANCOPS,
Okay.
the annual national conference of principals of secondary schools, and then we have the NUT. Okay. These are the associations that normally help teachers to secure whatever opportunity they want to secure. Okay. But then in the part of the health facilities, these are all health facilities are general issues for everybody.
Okay.
So that, but there's no specific association apart from these two that help teachers to make sure that yes, they get the right medical attention they require.
Actually, the association is under the directives of labor union.
Okay.
The NLC are the backbone of everything.
Okay.
And you know the teachers union, that is the NUT, is part and parcel of the NLC.
Okay.
That association under the labor has come up with these principles so that we can be able to help our team teachers.
Okay.
And we are even planning to see how, if and every teacher can even retire, they can be able to continue assessing the facility. It depends on the level of contribution that we likely render to the scheme.
That association, we are under that association, it is NUT. NUT will assign this form that have been given from the State Ministry of Health. It will give it to some branches or other associations related to that NUT, and we are going to distribute it to the teachers through LES.
Gaskiya, sincerely speaking, I enjoy a lot because I have direct access to go to the hospital anytime, anywhere, and prescribe for my children or for me with a little of money. Example, if I want to buy a medicine of 1,000 naira, they can collect 100 naira from me. So they help me in this fees.
Okay. Yes, they are most. They are all civil servants, and I believe anything if it involves biodata issues. So maybe in the process of capturing the information, some teachers later they reported that their names were not there, or at the end of the day, some of the required informations needed from the teachers, they may not be found at the same time. So that is why this JICHMA, they took it very, very hard time because they complete their programs. For example, if you go to a particular LGA where they have 200 teachers, they may likely capture only 50 or 100 because other teachers were not able to provide the basic necessary data for the entry. So these are some of the challenges actually the JICHMA, they have it, and the teachers already they encountered.
Health issue. The only thing is that the JICHMA maybe they select some of the medicine that we cannot get access with it. Why? Because the medicine is cost. For example, there is some things. Maybe if you have, let's say, disease like sickle and other things, the big things, you cannot get it. Why? Because they engage only some drugs that they can give the beneficiaries from JICHMA.
Okay, so I think one of the important issues is, first of all, awareness issue. There are people who are fully not aware of those services that are available for them to access. So we have an issue to do with demand creation. Likewise, also there might be issues here and there where you go to a facility that does not have the scope of services that you require, and you may need to be referred, and some people are not conversant with the referral process. That's also some kind of challenge. There are issues where also the services, the money that is provided for these services is short of what can be provided. For instance, somebody has fallen from a tree and has broken his thigh. So there are limitations on what kind of services this scheme I talk about can actually cover. So we still have a situation whereby, yes, teachers can be challenged medically in terms of their health. and then they cannot access services based on the existing policies. They have to provide out of pocket, and that means they have to pay off from their pockets for this service to be provided. So this is yet another challenge that they may have. You can also look at the issue of teachers after retirement, because the scheme does not cover retirees. And we have a large chunk of people who retire quickly, and then at the time that they need these services the most, and that is the time these services are not available for them. We have to look at another package which is looking at retired personnel, how they are going to continue enjoying this kind of services, because morbidity, that is the illnesses, usually increase when somebody approaches old age. So these are some of the challenges that we can quickly think of in terms of provision of these services by the guidelines that are put in place.
Okay, the barrier is the medicine. Each medicine that has the highest cost, here in Jichima, we don't have access to the medicine. They can write it and go and buy it outside the hospital. That is the major barrier that we can challenge.
The barrier for that hinder teachers, unless you are not a teacher. But if you are a teacher, they have take the list of all teachers in the state and used to give that form for the exactly number of that teachers to fill it. If you fill it, so you have been enrolled.
And actually, I cannot pinpoint any major barrier, because if there is to be any barrier, or if there are to be any barriers, it should be maybe from our own side, the level of sensitization. Because once we sensitize these teachers, enough, they will realize their rights. So definitely they can go and access healthcare services based on those rights that is prescribed by Jichima. And we're doing a lot. Even today, we had a meeting with healthcare providers on issue of quality of healthcare services. And don't forget, the teachers form a greater percentage of the public servant in Jigawa State. I cannot be able to tell you the exact figure, but I can categorically tell you that I'm sure more than half of our enrollees are teachers. Most especially primary school teachers. And these are the downtrodden people. And these are the ones that we usually focus on, because they are the ones that live in villages. They are the ones that don't even know their right. They don't even know the difference from their right. And you have to do a lot of work, a lot of mobilization. You sensitize them the most so that they will know that it's their right to access these health services. Otherwise, there will be a lacuna, there will be a vacuum. They cannot be able to access, or they will go to the hospital, and the hospital staff will maybe harass them, intimidate them, and other things like that. Because what we realize is the financial barrier is the greatest thing. Because even if the government build all the hospitals, all the facilities, the primary health centers, the clinics, and what have you, there is no system in place that will guarantee you to access care if you don't have money. That's why out of pocket in Nigeria is more than 70%. And in Jigawa is over 80%. Most of the things people have to remove from their pocket and go and to access care. So that's why at the end of the day you find people selling land, selling properties for them to, even some getting loans for them to go and maybe access healthcare services. So it's really daunting. So that's why we're looking at that. We want to ensure that within the ambit of the universal health coverage, we ensure that we look at equity, we look at quality. At the end of the day, we have to ensure that those teachers do not suffer from financial loss as a result of their illnesses.
Well, the most important barrier one is probably ignorance. Probably some teachers will not have the knowledge of trying to key into the process to secure this kind of benefits. And there isn't any issue of congestion. There isn't any issue of financial burden on them. And there isn't any issue of time constraint. As far as somebody is sick and they want to go to the hospital, they can go. The ministry can release them. But unless if somebody doesn't even know how the process is, other than the policy on ground, how it's being beneficial to himself or to his family, that's the only barrier. But apart from that, there ain't any barrier so far as we know. Anybody who happens to become more and more enlightened concerning this will definitely continue to benefit from that program. And he can go to any extent to benefit as far as he is concerned.
You see, there has to be a barrier, but all right. In some cases, You know, our teachers are secluded almost all over. Okay. Wherever you go to a village, you will see a teacher there. Sometimes the facility there may not be registered as a facility where you can be able to access. You have to go to a longer distance, for example, from one destination to another, in order to seek that to see the facility and access the drugs there. So that is one of the barriers. And sometimes we have a barrier whereby still we are lacking a lot of our teachers are not fully sensitized on the scheme, even though the union is doing all the way in tools to see that our teachers are mobilized, are sensitized on how to access the facility. And we also have a barrier whereby we usually experience some problem within the facilities in the course of managerial activities. For example, sometimes you can go to a facility with certain level of sickness, and that facility will tell you that they don't have that drugs, or they were not opportune to carry all that very big sickness to be cured. Even though there is a referral whereby you can refer that body of sickness to another facility whereby you can be able to access the facility.
Yeah, health shelters that provide are known by people who benefit from different sets of the health insurance schemes. Like I said, the formal sector, the equity program, the pre-MNCH, NHIS from the national program, they all have facilities where people prefer to go. But there are a large number of those facilities that this kind of services are not provided at those facilities. And that is where, incidentally, some of these facilities are those that are actually within the geographical location of where teachers live, especially rural areas where you have one school, one facility, and it might happen such that the facility is not part of those that we are covering with this kind of services. So it's a conversation that's ongoing to look at how we can expand coverage both in geography and in terms of breadth and length, in terms of the size of the package and in terms of geographical coverage. But yes, we know there are facilities that cannot provide these services, and teachers may live close to those facilities, and so they may need to travel longer distances than necessary for this service to be available for them. This is one of the challenges, again, that we'll be talking about soon.
Yeah, actually, we can say it is a subsidized package, quite all right, because it is where you'll be packing your money, for example, in form of contribution. Okay. And then later, you can go to the hospital and access that facility. And it is not all that necessary. All the teachers will be attending the facility at a time. And you'll find it that maybe in the registered teachers, maybe they were registered in the facility, let's say 50 of them. Okay. Hardly could you see 10 of them accessing the facility at a time. Okay. So because of the capitation, food included there, the drugs that are being sold must be in a subsidized rate so that it can be able to cater the needs of our teachers.
So it works like an health insurance?
Yeah, it's just a health insurance scheme.
Okay.
Yeah.
And then there are specific hospitals that...
Yeah, there are specific hospitals where you can be updated that have been registered with the scheme. Okay. That is the Tichima.
All right, sir.
That facility, we have almost 200 facilities across the state.
Okay, sir.
And outside.
Okay.
No, it's only Jichima. They are subsidized because maybe the medicine of 1,000, you can give 100 naira. So you see the subsidy, a lot of subsidy here. Maybe you can say 10%.
There's at least 3 hospitals, which is General Hospital, Rashid Shakoni, and Bashir. Okay. You can select anyone among these 3. You can register with 1 or 2. Okay. You as a principal, you can select, and if you have children, you can select, and your wife. So you can select at least 2 hospitals.
There is a policy manner. Any civil servant in our state has the access, if he's registered. Remember, if he's registered with this Jichima, he has direct access to the medicine at any hospital he like.
You asked me about policy before, but the policy actually is the Jichima, that is the health insurance scheme.
Okay.
It's a very right way where you can be able to access a facility on a health ground.
Okay.
That is the major policy we are having in the state. And that Jichima is being called the State Health Insurance Scheme, mainly registered by all the workers in the state, including teachers. And you know, teachers are the largest organization in all the trade unions. You will see almost all the attendants are partly the teachers there. because it's secreted almost all over in the state, secreted within, even in the villages and nearby remotest places.
This Jechima is the policy from the state. All the state workers should be enrolled in this Jechima. Yes.
Role that we play. The person is that we made it very clear to them. This program is a compulsory, not only for teachers, but all for the civil servant in Jigawa State. Therefore, teachers are not going to pay their money through their pocket. Whether they like it or not, their salary will be deducted for the take-up of this program. Therefore, the SUBEP, actually we took this pain. Therefore, we provide this Jechima with the transport. We give them some of our staff. And when we reach to the LGA again, the LGA Education Secretary will give them another staff so that they will go around to all schools. Because if you ask the teachers and say they should come down to the LGA where they will be captured, they will not come. Therefore, we have taken all these responsibilities to provide vehicles, to pull these vehicles, so that this Jechima they can reach teachers at their respective localities. So this is one of the major roles that the SUBEP undertaken.
So the major role that we are playing on this Jechima, we are gathering the head teachers and give them training and tell them that they should tell all the teachers to make sure that they have been enrolled on this Jechima system that we are doing in the state.
Well, we continue talking to the education sector to look at how we can collaborate in these strides, especially looking at the content of the school health policy to see what is the package of this revised policy. To see, as providers of services, we need to understand the stakeholders that are in need of these services. All the health insurance program procure services from our own settings because we are the providers of these services. What we are trying to do is to ensure that we have quality packages in all the facilities, the position of high quality health personnel at these facilities. Right now, we're in the process of recruiting additional midwives into the scheme. Nearly over 300 are going to be provided just to ensure that maternal services are strengthened. We are also providing support to ensure that preventive services such as immunization and nutrition programming are optimum at all the facilities that we have at the PHC level. So it's an ongoing conversation. Keep on improving, keep on looking at your challenges and keep on getting better. And that's what we do here.
As I said, there are two things. You have to look at the demand side. You have to look at the supply side. When we talk about supply side in healthcare system, we are talking about the healthcare providers. Is it a tertiary hospital? Is it a general hospital? Is it a primary health center? Then you look at demand side, we're looking at the patient side, those that will access the care. So that's why we're always engaging the Ministry of Health. Like Jechima don't own facilities. The institutions or organizations in the state that own facilities are two. Ministry of Health, who owns the general hospitals and the specialist hospitals, and the Primary Healthcare Development Agency that owns the primary healthcare centers and the basic clinic and the basic healthcare centers and the primary clinics. So we have to engage them day in, day out to ensure that there are adequate staff there, drugs are available, quality drugs are available, you understand, and there is expertise by the time you offer these services to people that come to them. And when you look at demand side, that's why we are always engaging with like our major stakeholder at the Nigerian Labour Congress, the Jigawa State chapter. We're always meeting with them. Even today we met with them. So we'll be discussing these issues with them, and we are going to have a very robust program very soon. I think by September, first week of September, to do more mobilization and sensitization so that on patients' rights, because I keep on repeating, people have to know their right before they can do anything. So once you do this, I think you are good to go. Both the supply and demand side, I think you are good to go. You have a very maybe excellent program in place.
Our role is one, we make sure that they are sensitized.
Okay.
They are given the basic required knowledge that yes, there are these points of ground. So whenever I have this problem, please don't hesitate to go to the right place to get it.
Okay.
These are things that the ministry can do. And then the second one is if anybody happens to write concerning his health and medical problem, definitely we'll attend it and we'll help him. We'll give him a senior request to encourage him to make sure he gets health so he can go back to his place of work. These are some of the and then we don't even, again, deny them from repeating. We don't stop them from going to repeat these kind of things. They are always given the opportunity to do so.
So as a body, you know, there is a provided board of trustee, and it happens that the Nigerian Union of Teachers is fully represented here as a board member. So right away, we influence our people on how to assess the facilities.
Okay.
And we even mobilize them, we sensitize them how to assess the facilities.
Okay.
That is why we find it very much easier to talk to our people anytime, and they used to channel all the problems that they experience in a center. For example, in one center, they were there for assessing the drug, but they say they don't have the drugs, or they give them less quantity drugs. They will quickly rush to us, and then we talk to the facility.
Since our state minister of health is doing very well, we don't normally, the only thing that we do is when we have serious problem in schools, especially our boarding schools, if there are need for some stipend or for some amount to be given to them to help them get what they wanted to get, we do that to them.
Okay.
For instance, like we buy some medicines, some tablets, some medicines, especially for female schools where you have so much problem with health, much more than the male schools. So these are the kind of support and assistance we give to these schools to continue to have health facilities available.
So our support to the teachers, we are supporting only head teachers because it is the association of only head teachers. Yes, they are the ones that give the dues to the association, and when some issues happen to them, we do our best to see that we give some amount to the head teacher that have that problems on health.
Yeah, we financially contributed our money there.
Okay.
We made a contribution. As a deduction, it depends on the percentage and the grade levels that a teacher is on to. So a teacher can contribute from 8,000, 4,000, 2,000. Even there are some that are contribute to 1,000. Okay. It depends on the level of salary and what have you.
Maybe availability of the medicine.
Okay.
Because I told you before that the medicine that has highest cost, the JICHMA, we the teachers, we don't have access to them in our JICHMA package. So I can say with the government, we can upgrade. They can upgrade the package so that teacher can have access, even of ration. Even if the teacher has a serious case disease, like maybe like hypertension, or maybe like diabetes, or any other disease, they can have access to this complete package of this JICHMA without any subsidy.
I think for now, the formal sector is doing a lot, ensuring that teachers are covered. But what is the challenge, like I said, is when they retire. And a good number of teachers end up in retirement age. And like I said, this is the time they are most challenged by medical conditions. So we need to look at how we are going to have package for the retirees and ensure that these services are available for them wherever they are. The other thing we can do is to make sure that we provide and optimize lower level facilities to provide this kind of services as close to where teachers live as possible, so that people don't have to travel for long distance, especially their families and young ones who are living in the downtrodden areas of the state, and then they cannot quickly go to the nearest facility and access care. So those are the areas that we think we need to improve upon.
There are two things. For example, whatever we do as far as purchasing of healthcare services for these teachers is concerned, we also depend solely on the premium we collect. So that's why now we want a situation where we want percentage, not fixed. So if it is percentage based, then anytime there is increase in price, automatically the money that will come to the NGOs will increase. We don't have to go and start doing another dialogue with NLC on how much do we increase and this and that, because we feel that this is very, very important. That's one. Another thing is that we want to solicit for government support now, because we are almost at that point, so that the government can come and support the agency with employer contribution, this will go a long way in ensuring better access to healthcare services for these teachers. That I assure you. Because as you are aware now, the salary do not include no more healthcare allowance, all these are removed. It's a consolidated salary that you take home, and out of that, it speaks amount that come to here for access to healthcare services. If we have the support of government in due course, things that are even outside the benefit package that we offer to teachers can be included in the future.
So this is the best things. It's the best things. This kind of the programs initiated by the government is the best things. Because if you allow the teachers, maybe they are suffering from certain kind of diseases, but they may not go to the hospitals because they are afraid of what they are going to spend. Sometimes they will be complaining of they don't have the money, whatever. But if they really know that when they go to the hospitals, these programs, Jichima will pay for the expenses of the medicines, therefore they will go to the hospital. So that I think this is the only areas.
I think that we are trying to make advice to the government that they should, before, when they recruit the teachers, before giving them or starting giving them the salary, they should be enrolled to that Jichima. This will be possible for the teacher to benefit that.
For example, when we say improve healthcare or how our teacher will be able to access the health facilities, we have been saying this, and our teachers have been sensitized on how to access the facilities. Okay. And apart from that, in Jigawa State we don't have much problem with the level of salary. We are being paid level 25th of every month. Okay. We are enjoying 30,000 minimum wage. So all the promotions has been settled. So all the social security that has to do with the government, we don't have any existing problem nowadays. Okay. And even with this facilities for health, our teachers adequately attended the clinics, the facility, and assess whatever the drug is available for them to improve their health facility. Okay, so healthcare.
It's general, not only teachers. If you look at, human resource for health is a serious concern, most especially in northern part of the country. It's a serious concern. Let me give you an example like the midwives. Now, we want a situation where we reduce maternal mortality rate among the general population, teachers inclusive. So no matter what you do, we don't have the human resource like the midwives and other things, you cannot be able to achieve much. And don't forget, we are adopting now 1 PHC per ward. Like Jigawa, we have 287 political wards. We want to ensure that within that catchment area of that political ward, there is at least one facility that will be able to take care of deliveries and other things like that. We advertise, but last year, we even couldn't make it because we don't even have the required number of midwives. But the state is doing greatly now because we have 3 midwife schools now in Jigawa State. 1 in Brunungkud, 1 in Hadeja, another midwife, and 1 in Babura now. So I assure you, when you come back in the next 3 years or 4 years, we have to be exporting midwives to other states. That I assure you. We'll have enough, we'll saturate the demand. Yeah.
In Jigawa, alhamdulillah, because our salary is more clear than other states, so that we thank God about our salary. So it's a choice of our government to increase the salary, or we want the salary to increase, but it's a choice of our government.
The factor that need more attention, in my view, maybe it's direct access of our pupils. Any pupils, any children in a school uniform, don't go to the hospital, you can receive direct package of pre-medicine in the hospital. That is what we want, because we as teachers, we have so many cases during the school hours. So we have to rush our pupils to the hospital. So we don't have our pupils don't have direct access to receive the medicine. We, the teachers, we buy medicine for them from our menu. So maybe if government consider our pupils in uniform, maybe not outside the school hours, even in the school during the school hours, not outside the school hours, to look out our pupils in the school uniform, to give them direct access to medicine.
Actually, you see, with regard to performance, that is the way we are undertaking our duty, and mostly this health issue doesn't have any impact on our activities there, especially in the schools.
Okay.
Because even the system really helps us very well. We may be able to go to the hospital in just a moment and access the health center at the facility there.
Okay.
Actually, we only have recorded almost not more than 10 teachers that are not attending the classrooms because of our health ground. And those that are having a very difficult situation, those that we believe they cannot continue rendering the services, we usually replace them with the active ones and give them all the benefits together. We don't have any problem with regard to benefit, either days or pension or what have you.
It can affect him because you as a teacher, whether you go and register or not, they can remove the allowance, the allowance from your salary, whether you register or not. Yes.
Okay. It will cause all this what you have listed, because when a teacher have no enough or adequate motivations, she will not be very happy, or he will not be happy on his work. And sometimes you can see him that go somewhere or thinking about what will he do to fill the gap for his health.
When you come to Jigawa State, in fact, when you go to any ward in the state, there is a constructed facility center there.
Okay.
Some of them are primary health care, basic health care, and other things are going there.
Okay.
So actually, there is no any social problem that diminish our teachers from attending such types of facility.
Okay.
And in fact, even if there is, the level of movement now, we can move in a vehicle, a motorcycle, all the road has been corrected. That is why we don't have much problem with that, with the accessing to the facilities.
These are medical conditions. It may be beyond that.
Okay.
So the overall thing is that there will be absenteeism. Teachers will not be able to teach, and even if they do, they will not be effective. The quality of teaching they will provide will be challenged, because if somebody is sick, either psychosexual or medical, or we are talking about related to illnesses such as acute illnesses, fever and all that, their performance will not be optimal. So it's going to be a comprehensive challenge to their medical condition and health situation. That includes their psyche, their somatic, their physical strength and energy, and then any other thing. And then the day the peoples are going to be the sufferers of the end result of all this.
Well, the mechanism is that the ministry, the zonal offices, the civil headquarters, the ANCOGs, and the unity all work in unison. And so if there is any opponent from somewhere which we feel is going to bring problems to our chest, we make sure when any of these agents will now go in to make sure that problem is being stemmed and it's not being allowed to grow. And the issue is, once anybody approaches the ministry with a problem, especially concerning its medical or health issue, is that will solve his wife or his children, the ministry do what it is possible to make sure he's given the support and the encouragement to make sure he goes to the right place to get medicine and he gets back to his work and then he continues with his work.
That's what we are saying. That's what you say. When you do a key stakeholder analysis, it helps a lot. It helps you greatly. By the time you involve the traditional rulers who have cascade of titles down to the lowest level, you will get it right. Because we are adopting that. Even in this new enrollment program, we've started to adopt that. Because the issue is to get across to these people. I think this is the main thing. Because somebody will fall sick, nobody will cares to even access care will be a problem. But if you involve the Ungua, the Degachi, the village will know. And they go and inform them, yeah, they have the right. They'll take them to the primary health. If it's above that, they will automatically refer. They will bring them to bigger centers where we'll take good care of them. So you have to have a network, and that's what we have done. We have to have a network that we are going to, apprehend anybody that falls sick or about falling sick. Certainly now, they said health is wealth. So you don't have to be told. You don't have to be a sightseer or anything to be told that, the impact or the effect of health on productivity. It's quite alarming. I cannot be able to give you the figures now. But illness or an ill teacher, what it will translate in terms of even GDP is great. The quantum is high. So definitely, there has to be this kind of issues. I will not be able to give you the figures right now, but I know it's great. So and that's why we feel that no matter what we do, we need to bring them on board. We have to ensure a healthy teacher population so they can impart, a better knowledge on our children. So that at the end of the day, it's a win-win situation. You improve their health, they improve the quality, of the education they give to your children and things, and then your children, whatever, they will excel to whatever level.
Yeah, it happens. If somebody is, for example, a teacher is ill, it has direct impact with the student actually. But in a situation whereby a clinic is sited there, even the student itself can be taken there for a form of treatment.
Okay.
And most of the time you see teachers, they used to have a first aid division in their school, whereby, for example, this period of malaria and other issues, they take care of them with their children within the school.
Okay.
That is why they were encouraged to open a small health facility center within the school for any first aid issue. Malaria and what have you can be cured easily. Okay. So that is what we usually advise in the university.
Absolutely, very much, because if you are not well, you can't teach directly. Not only you, but if your spouse or your children are sick and then they call your attention that somebody is convulsing or somebody has high-grade fever, you can be sure of absenteeism of the teacher that very day in school. So it will introduce an issue of low performance by the teacher and therefore poor learning outcomes. Therefore, putting attention to teachers' health and the welfare of their family is core in terms of providing better learning outcome for students and pupils in secondary and all levels of education. It's really pertinent that while you're addressing the teacher, you're also looking at the family where the teacher comes from, because sometimes the distraction comes from members of the family, not on the index person we're talking about. Providing setting where we have welfare packages, health for instance, for these teachers, their families will improve learning outcomes and give us better economic productivity for young ones that are coming up into the state.
Well, the effect is lack of productivity, because once our teachers are sick, they don't get medicine, they don't go to a hospital, they don't have things to use to finance their medical bill, then definitely there will be problem. Because one, they will not be good school, that means there will be no attendance for teachers, and then that means there will be no teaching, and therefore it means that children will not learn, and even the facility will be utilized. So once the issue of health now is a stumbling block to all these issues now, then definitely there won't be any progress. But coincidentally, we have not been having this kind of problem. Of course, we cannot rule out having 1 or 2 instances which are not known to us, you see, which don't come to our children, because we cannot raise our since we don't know it. But anything that comes to us and which we know we can attempt to, we definitely attempt it on time together as a rescue. And the child will continue to do the work. Yes, and will do.
Well, they are all human beings, I know. And once you have something to help you, so maybe you have something that will encourage you to do more. So we know our teachers, particularly those at the rural areas, actually they are not in habit of going to the hospitals. Some of them, they are sick, having different kind of the illness, but actually without this kind of the Jichima intervention, most of the teachers, they will remain in their localities, they will not even report to the hospital, therefore you may not even know what is happening to them. So at the end of the day, some is suffering from malaria, others suffering from other diseases. So although they go to the working place, they can just do their work half-heartedly because they cannot stay in the school for the whole period because they are sick. So maybe if they are not fully healthy enough,
it will affect the student because when a teacher doesn't have the access to teach the student well, so the student will not have good teaching and learning in their respective schools.
No, gaskiya in our state, we can say they are justified. They are justified. Even you are male teacher or you are female teacher, they are justified, gaskiya, sincerely.
In general, if you go to the hospital, you find out that females are more than men in the hospital.
Absolutely. Why? Because sometimes they get pregnant. Sometimes they're also breastfeeding. What they need are additional packages of care, such as breastfeeding points within where they are working. When they are pregnant, sometimes they are challenged by medical conditions, sickness from one form of it to another. So it increases their vulnerability to illnesses and all that. So it will be good if we have a different package addressing female teachers, especially with regards to maternity leave packages, as well as breastfeeding policies, and also providing within school kind of antenatal package where problem can be addressed promptly when they occur within the school environment.
Well, they can, but vulnerability in terms of health is to everybody's concern. Because you can get a female teacher who is very strong and stronger than a male teacher if his health is very fragile. But for the fact that women are women, they need special attention, they need special care because of their own nature, then definitely we have to agree that yes, they are more vulnerable to the men in terms of health issues.
Yeah, actually, you see when we say females, actually there are some barriers and they likely exist between the two sports. Actually, female teachers, in fact, they are the most registered personality in the scheme, and they assess the facility in a very large quantity. We know the level of health between the two. In fact, it has a different issue there. Whereas other problems that females encounter, the males are not encountering. So they don't have much challenges quite well in assessing the facility. And because of the level of sensitization and awareness raising, actually our female side usually attend all the facilities, all the healthcare there without any challenges quite well.
Why? Because most of the females, they believe only on their civil servant, because they will not go and participate for other things to do, whether business or so.
So yes, it may be because some female teachers have many things or many problems in their own way to teach or other life, because when they have get pregnant, you can find them that sometimes they are not well, fever, headache, and other problems is looking for them. And when they deliver the child, they have some problem for feeding the child. So by that time, they must go back to home and stay until their baby got about 3 or 7 months. Then they will come back to continue their duty.
Not really. We don't have much challenges. All I am saying is that you have to understand that we are about 1.5 years into this program. This is a brand new program that we've started. So for now, the challenges we are facing mostly reside with the healthcare providers. Issue of quality, and that's what necessitated even today's meeting, because we emphasize we don't want any services, we want quality service. So I think this is the major challenge, and we are trying to address this challenge with time, and I'm sure it's going to be history.
Well, any barrier or challenge maybe can only come through the funding system. If the government is not funding the health sector, then most of these things they are supposed to do may not be there. So the best thing is once they get adequate health facilities and health support, then it means work will continue to go. But if no funding is being provided to the Ministry of Health, they don't have money to buy medicines, to buy condiments, to buy this and that for the tertiary institutions, then where will they get these things from? no individual can contribute much more than his own pocket as far as health issues are concerned. So the major challenge is once there is the funding, then there will be no more challenge. But if the funding for the health part materials to be purchased are not there, then definitely there will be a challenge. Because people may fall into the trap of not getting the required health, medical treatment they need because they don't have money to pay.
Funding issue, there may be funding issues, for instance, students, teacher care can be challenged by inadequate funding. That might be a problem. Like I also say, geographical access, especially for rural schools where they are far away from facilities. A huge chunk of their energy and time can be spent accessing care because they need to travel for some distances. So these are some of the things. We have barely 760 health facilities and we have 2,000 schools. So you can imagine the what we call the distribution of facilities vis-a-vis school facility ratio. So those challenges are also going to be there, just to mention but a few.
So actually we don't know, but to me, I think most of those are from the JICHMA, those who captured, maybe they lack some technical know-how on the computer issue. That is why sometimes even if you give them the information, they capture your information, your biodata 1 day or 2 days, they would still say they need something from you. And so maybe I think that kind of things, lapses come from them. I hope you are getting me now. Because by the time they are taking data, so immediately, so 1 or 2 days, they would still come back and say they need some information from such kind of teacher. So some teachers, sometimes, again, they have the same problem with the biodata takers. So maybe I think these are the areas where they have the problems.
The barrier is sometimes you can go and consult a doctor, the doctor can prescribe you the medicine, and the medicine that we can come and collect it, they can say we can wait for the code from the JICHMA office. The waiting is take longer, just like 10 minutes, 20 minutes, up to 1 hour to 2 hours. So as a patient, you cannot wait for 10 minutes up to 1 hour to deliver a medicine. Because that is our major challenge.
No, actually, even though we don't have much challenges in Jigawa State, but even if we have it, we usually go directly and address that issue. Okay. For example, that is why we are very much active in sensitization. We are very much active in mobilization. Okay. And we are very much active in listening the complaint from our teachers. Whenever they say we have this problem, we will quickly address it. Okay. We have branches almost all over in the local government. In the 27 local government, we have our branches where they will be able to take their complaint. Okay. And if the complaint is in fact bigger than the jurisdiction, they will quickly send it to the state.
Okay. So there are some barriers that we are getting. Sometimes when our teachers go to the hospital, they need after the doctor gives them the description. When you go to the medicine center, they will say you will have this, but we have this, we don't have this. Therefore, you should go to the chemist and buy this with your own money. After we have give them that money have been deducted from our salary.
Actually, the health facilities, although it has been taken care of. Okay. What we usually experience before the existence of JICHMA is the economic situation. Okay. Actually, we find it very much difficult sometimes for our teachers to access health facilities. But after the scheme, everybody is contributing monthly. We have a direct contact with the scheme all the time and addressing our health issues. Okay. So we actually don't have any problem with access now. Yeah.
Okay, so we are doing reprogramming to provide what do you call it? We call it outreach services for some of those rurally based schools. People from health facilities can reach out to them and provide school care. There are instances where the school provide clinics, and then we send some of our staff to manage some of their clinics. And there are times that we can also engage the health masters in kind of sensitization and training during certain campaigns and certain certain illnesses to get them acquainted on how to recognize early symptoms and refer quickly. And there are instances where we site facilities in areas that we need those kind of facilities to be cited. That is increasing the number of health facilities close to where teachers and other population live in rural areas. And we are also trying to ensure that we strengthen the referral system such that lower level facility will not have hurdles taking cases that are complicated to their level to the next care until the issue that is at hand is actually resolved finally. So these are all the things that we do continuously in the conversation to ensure that access to packages of these services are available for teachers.
So the solution that I wanted to be to put inside is that government should be checked to each hospital that have been assigned some teachers or some workers to that, to see that are they given the medicine correctly, or they will have someone and don't have someone.
The only solution I can see is that the government will look at the teachers, because in the other ways, the teachers is not like the other civil servants, so they have to look for them. For example, if it is possible, again, to add from where they stop, to add more drugs about the one that they did now.
Well, the Ministry of Health in the state, the primary attention, and then other health issues across the state, like general hospitals, the quarters hospitals around, they are not that supposed to give that attention. And of course, any other person who also feels that has the weather wizard to help and to contribute into the program, he can do it. That will help to complement what the government is doing and what the ministry is also doing. That's it.
First of all, government, people, the citizens that we're working on, civil-based organization to ensure there is accountability, the legislature to have an oversight, international donor organization to provide resource base, to broaden the resource base, local donor organization to also increase the resource base, as well as the media to enlighten the population, to mention but a few.
There are 2 or 3 capital functionaries by law. You see, after the DCMA, that is operation stages, whereby a body there, whereby the money being accumulated is being monitored, is being put in place for an investment, and the other second issue is the actual presentation and the actual implementation of the program within the facility centers. There are doctors there, there are nurses there, there are health officers there that usually run all the activity that has to do with health. And the last one is the beneficiaries, we the teachers. You see, so we mobilize our teachers, they attended the facility, so that is why the synergy is very much good and we don't have much problem there.
So the partners, most of them are the government, and there are some people that have been assigned by the government to look over that problem and solve it.
I think, as I told you, there I think are 2 major issues. One, sustainability, because whatever you do, you have to look at the sustainability factor. How do we sustain the good thing that we've started? I know you cannot sustain things without, adequate and sufficient funding. So this is one of the issues. Funding is an issue, but as I told you, we've been engaging with the government to see how they can come in to further strengthen and support this system for sustainability. 2 is a general issue that concerns, because we deal directly with healthcare providers, issue that borders on quality. And quality is a kind of vicious cycle. When you don't have adequate manpower, it's a problem. When we did analysis, do you know what is the doctor-patient ratio in Jigawa? 1 doctor to 44,000. So we still have a long way to go. Although the state is doing much in terms of doing that, they have sent people, about I think 120 to China. They have graduated this year. They have come back, they will write the NNDC exam. They have sent some to Sudan, other than the local training that they're doing. So I think even that, we're hoping in the next 5-10 years, we'll saturate the place with even doctors. But, we have plans and we're working towards our plan.
Well, we're always looking at the inflation as a challenge to the package that we are providing. You'd have costed a form of service that you provide at a specific cost. You have an agreement, and then the next couple of weeks, those prices have changed. So drawing back is actually this back and forth thing is bringing a challenge in terms of implementation. Of course, there are issues to do also with awareness. People to understand, first of all, these services are available, and not just they're available, but these are the packages that are within what you are actually purchasing. People think once you have an insurance program on your head, you can just ask for anything, but these are counted. We have 1, 2, 3 things that can be provided, and people need to know them. If you come with an sickness that is within, or that is outside the scope of the package which you are paying for, you are not likely going to have those services provided to you. And that brings about rancor, especially at the facility, between people who provide these services and the beneficiaries of these services. So awareness creation in terms of availability and also the scope of the services that can be provided are part of the challenge that we're looking at. We're looking at also the issue of inflation as it comes to pricing. These are some of the things that we face.
What we need, like I told you before, is 100% package of healthcare facility. That is what we need, because we are now in subsidy. So we need the full package.
All right, thank you very much for your time.
The experience and the major concern is that for people to know that yes, there is a policy on ground concerning the health of teachers or the health of servants. When they don't know that there is that policy, then it means whatever effort you'll be making, it will be a waste of time, because people will to utilize it 100% and as properly as possible. But we'll continue to sensitize them, to empower them, to give them the basic knowledge, and then to show them also, yes, this kind of policy exists so time and it's meant to do this. Okay. This kind of policy exists so time and it's meant to do this. Once that is done, I think we are creating the cost clear for all our teachers to access health facilities wherever they are within the state.
Okay, so what I need actually, the government should give more time for teachers to go and recapture their data. Because most of these people, if they reach a particular school or a particular locality, they will be able to capture the name of the whole teachers. Sometimes if they are 20, they will capture 10, promising maybe tomorrow or next tomorrow they will come back for, and they will take a month or later they will not come. So I'm just calling on this JICHMA management that they should understand that currently we have some teachers, by now, that their names are not still captured. So we are still calling on them, so they should please repeat it back to their localities so that they would be able to be enrolled into the program.
So our need is that we need the government to look over the problem of the teachers all, either in cash or in kinds. For example, even the salary of the teachers is not enough. It's better for the government to increase the salary of the teachers. This will help the teachers to teach successfully and give the output of the teach.
The health in the state, it helps the teachers a lot. It will contribute toward. Why? Because at that time, there is no JICHMA. If I want to go to the hospital, maybe I can take at least 5,000 to 6,000 or 4,000. But this time around, if I get 1,000, it's okay for me.
Well, actually, the concern here, you see, there are certain level of sickness in regards to that is not prevalent. For example, that issue of kidney problem is in fact bigger than the scheme to take care of. Definitely, we used to render our contribution how to ease that problem within our teachers level. So even if we can even demand an intervention for either the donor agencies or somewhere else, so that we can be able to take care of this hypertension, the issue of hypertension, the issue of kidney problem, the issue of hepatitis, all that the sugar problem, all that big problems that mainly the scheme cannot be able to take handle this. So the only concern that we are having, and sometimes our teachers cannot be left out. They must experience these type of problems, and we find it very much difficult to manage. That is why we sometimes state for help from the government, from the donor agencies, and from what have you, and even the union itself.